Hi guys, I'm Maylin Dovan, certified athletic therapist and founder of Rehab-U Movement and Performance Therapy. I have the pleasure of being with my good friend Alexis, who is the owner of this beautiful CrossFit box that we are in. He's also a kinesiologist and level 3 CrossFit coach. We're going to talk about SI joint pain, how to deal with SI joint pain, and he actually has SI joint pain, so it'll be interesting. So. SI joint pain is really complex. Again, it may require several elements to addressing it, including manual therapy. However, there are many things that you can do as far as doing mobilization, activation, and integration exercises to help deal with the dysfunction and the pain. Now, motion in the lumbar spine is accompanied by motion in the SI joint, and also movement in the pelvis. So we know that muscles that are active in stabilizing the lumbar spine also have the ability to stabilize the SI joint. So if you address motor control strategies for stabilization of the lumbar spine, you will also have an effect on SI dysfunction and often on SI pain. All right, so the SI joint really is not a joint that has a lot of mobility. That little mobility that it has, though, is important to preserve, and getting some movement in there is interesting, certainly interesting as part of the mobilization sequence, for example. But the most important thing you need to remember is that you need to stabilize the joint, which means you need to remove stress from the ligaments, the SI joint ligaments. And how do you do that? Well, you want to hold the joint within its normal range of motion. And what does that come down to in our exercise language? That's pelvic stability. So you see how that kind of links with all the lumbar spine stuff we do and the low back pain stuff we do, okay? So that being said, in a mobilization sequence, you want to create space, or better space to move within. And like I said, the SI joint has a little bit of mobility that we need to preserve. So here are a couple of exercises that you can do to kind of get some movement in there, get the circulation going, have that pain relieving effect of moving things around, and then we'll kind of restabilize all of that in the activation and integration sequences. So our first exercise is an SI joint mobilization exercise, side lying. So, hey guys, thanks for watching our videos, and don't forget to subscribe to our YouTube channel. What's important here is that the hips are really stacked one on top of the other, as well as the shoulders. We don't want Alexis to be twisted. Hips are stacked. Hips are 90 degrees, knees are 90 degrees, and movement here is really subtle, meaning I don't want him twisting all over. He's just trying to roll the ball between his knees, which is kind of gonna push his hip back over here and kind of mobilize his SI joint right behind here. So it's a very subtle movement. It's not large range of motion. It's the kind of exercise that will get that natural little mobility of the SI joint, get it moving. You could do this on both sides or do your affected side up, okay? That's one exercise. Another exercise that really is helpful and usually relieves a lot of discomfort is a pelvic clock. So, you know how when we move the pelvis around, we often do pelvic tilting, where we do anterior, posterior tilt. We're gonna do the same thing here, but we're gonna have one knee bent, one leg extended, and maybe you could push it out a little bit, have it a little bit more diagonal. And what we're gonna do is we're gonna do pelvic tilts, but really diagonal. So as he tilts, he's gonna go diagonally towards the foot and then tilt diagonally towards the opposite shoulder. So on an inhale, he's gonna tilt the pelvis anterior diagonally towards the foot. And on the exhale, he's gonna tilt the pelvis posteriorly, aiming towards that opposite shoulder, okay? Now again, you could do this on both sides. Let's say you've got bilateral issues. Typically people have an issue on one side. So in this case, if the right side is bothering you, you extend the left leg. If the left side is bothering you, you extend the right leg, okay? So there's your pelvic clocks. And we're gonna come up out of here for a sec. How's that feel? So, next order is to re-stabilize kind of that pelvis. And remember I said you want to work on that pelvic stability. It's important to keep the joint within its normal range of motion. And the SI joint has range that kind of moves along with the movement of the pelvis. So I said in order to protect the ligaments and make sure that we're working within the joint's normal range of motion, what we want to control is pelvic tilting. So we don't want to be in too much anterior pelvic tilt or in too much posterior pelvic tilt as we work and load the extremities. Otherwise, we're kind of irritating that SI joint all the time. So one great way of doing this, or one exercise that I like a lot, is a supine band march, because you're working on balancing out the hip flexors and the hip extensors while keeping that pelvis neutral, so not going into anterior and posterior tilt. So the supine band march, it's going to be a challenge. But he needs to get this work in his SI. So we start 90-90. And what he's going to do is, as he pushes one foot out to extend, he maintains this one into flexion. And come back down, and then try to drive that heel down towards the ground. Yeah, there we go. So getting a nice hip extension, holding the other one in flexion, and of course keeping the pelvis as neutral as possible, so it's not going into anterior tilt or posterior tilt, okay? So really interesting way of balancing out that work. When you're when you're working the glutes, you're not going into excessive posterior tilt, and when you're working on the hip flexors, you're not going into excessive anterior tilt. And that's what's going to be important, to not stress the SI joint too much, all right? Thanks. He likes it, he wants to keep going. And then in the integration sequence, what we always want to do is we want to start to load that, okay? Best way to load the SI joint and get that force closure of the SI joint, i.e. getting that stability through the muscles that kind of cross that joint, is to do stuff that looks like gait, you know, or kind of stimulates the force transfer of gait. So we talk a lot about doing stuff that solicits the functional back line. This exercise I like because it's very simple, and again, easy to focus on the movement because there aren't too many elements of the movement. So he's in a nice 90-90 position, and he's just gonna fold towards his front knee. So he's not shifting the hips back as he folds, he's staying in that 90 position, so all the weight goes to his front foot, and he's really loading that left hip, and therefore loading that left SI joint. Pausing at the front there is important, really loading that, and then coming back up into neutral. So a nice pause in the front so he feels that weight loaded on the foot, and then pushing away back up into neutral. Awesome. Okay, and obviously that's just an example of one exercise for each of the mobilization, activation, integration sequence. Well, we had two for the mobilization sequence, but the idea with the activation is you want to work on hip flexors while maintaining your pelvis and not going into too much anterior tilt. Work on your hip extensors, so your glutes, but without bringing the pelvis into excessive posterior tilt, because that would stress the SI joint. So maintaining that kind of neutral. And then in the integration phase, think functional backline, gait, single leg kind of stuff, bringing load into that SI joint and progressing from there. So there you go, dealing with SI joint pain.